A very warm welcome to you and thank you so much for joining us in this special program brought to you by Etosha Gardens and Memorial Park. We do appreciate you also sending us your questions, comments and your contributions during the course of the segment, as we always do appreciate hearing from you. Extending our discussions around the issues of wellness, I'm joined in studio by Dr. Tinaye Muzamindu, who is a wellness specialist, and she'll be sharing a few brief nuggets on how we too can also help in maintaining our state of mental wellness. Thank you so much for joining us once again and looking forward to our discussion.
Thank you for having me, Farai.
Now, previously in our discussion before, we were looking at exactly what wellness is and how importantly it applies to us being actively conscious in our day-to-day activities. You also gave a few tips on how one can be able to be physically active and also employ exercise as a key area. But I do want to also be able to touch on how mental health is associated with wellness, but at the same time, how it's tied to the high rate of suicide.
Thank you for that question. So mental health or mental illness is actually a non-communicable disease. So like we mentioned earlier on, that non-communicable diseases are not transferable from person to person. So it's a non-communicable disease, and because we said earlier on, these non-communicable diseases have become very popular. They contribute to about 70%, in some countries maybe lower, of the causes of disease and mortality. Mental health, unfortunately, in our population and in our setting, it's unfortunate that it doesn't get enough attention. There are people who have mental health issues or mental health conditions, but people are embarrassed to talk about mental health. If they have somebody in their family who's got a mental health condition, they are slow to seek help. In most circumstances, they will have noticed that there's something wrong with the family member or an individual in the family, but they just watch it deteriorate. And by the time they go to the hospital, usually they are in the euphoric stages or the later stage of the mental condition. And yet there will have been telltale signs right from where it started. And it's unfortunate that most people are, I don't know whether it's fear or it's embarrassment. Right. It varies from people to people, from person to person and family to family. But what we'd like to encourage people is that there's nothing embarrassing and there's nothing to be afraid of when it comes to mental health or mental illness. Right. It's just another illness.
Right. What about when you have circumstances where someone refers to having had gone through what's called a mental breakdown? What exactly is that, and how does one know if they're experiencing that?
So a mental breakdown means you've really hit a bad spot, and it's obvious to your family members. And if you're somebody who goes to work, it may be obvious at work. It varies from person to person because we all have different personalities. So with some people, they may just break down and start weeping and crying. Some people may burst out in anger. Some people may assault other people, or some people will just start using a substance, whether it be alcohol or other drugs, illicit drugs. So there's no one size fits all when it comes to to a breakdown. Right. It can come in any form. Some people will just become withdrawn, extremely withdrawn. Maybe they were relatively outgoing and then they are withdrawn. Even at work, they won't be contributing much to the contributions at work, and at home, when they get home, maybe they just take their meal, they eat in their room and they go to sleep. They don't interact with the family. Right. So it comes in various forms. So basically what we're saying is that when the people close to you are the people who are likely to first identify that you're going through a rough patch and you're heading towards a breakdown, or sometimes if it's work, they call it burnout. So the people close to you are the ones who are likely to first identify it, because they know you well. Right. They'll see the changes.
That's a very fair indicator to also use, but also tying people in. The term peer pressure is normally associated to adolescents, but the same can be extended to adults. How do societal pressures affect one's mental state, but at the same time, wellness?
Yes, peer pressure, yes, we mainly use that term when we're talking about youths and adolescents, but it does apply to adults as well, especially in the world that we live in now. There's so many gadgets and gizmos, phones, cars, televisions, homes, holidays, all those things. They can give people who are adults pressure, and even children as well, when they're hearing that too. We went to a holiday holiday in August and they haven't been anyway. So what's important as an individual is to stay in your lane.
Right.
That saying says a lot. Be content. So in wellness, we strongly encourage gratefulness. So before you start to think about what's going wrong or what you don't have in your life, it's always important to first list the things that you have. And you'll find you've got a long list. You've got a long list of things that you have. You've got a long list of things that you can be grateful for that other people don't have.
Right. Now, in closing, maybe you could highlight to us how individuals who seek counsel from experts such as yourselves go about doing so, but more importantly also what process they can expect to have to practically go through to address some of the challenges they may have around issues of wellness.
Thank you for bringing up that question, because it then also shares with the population how easy it is to access mental health facilities. So in Zimbabwe, there are many clinics. Even in the rural areas, there are clinics. So almost everybody has got access to a clinic, whether it be in town or in the rural areas. That's your first point of call, because at any clinic, even in the rural areas, there is a healthcare provider there.
Right.
It doesn't matter what level it is of healthcare provider. They are a trained, skilled expert in health.
Right. Would it be fair to then also specifically appreciate that social workers would be the ones who government, would be the employees who government would have address any issues to the public around mental health?
Also, everyone is basically involved, but I suppose the expertise with social workers is that they move around the communities.
Right.
And in the rural areas, they've got what are called rural health workers. So they mini social workers. So their role is to move around the communities, ask people in the homestead, how are you doing? How is everyone? Is everyone doing okay? Are you facing any challenges? And they can pick up these things. They may be told, we've got a son. He's just keeping to himself. It's been like that for 3 months. He never used to be like that. Then she can highlight and say, I think you must come with him to the clinic as soon as possible, so that the nurse at the clinic can have a chat with him, and if it's possible, please come along. So with mental health and with mental illness, it's very critical to have social support from the family.
Right.
Very critical.
Your final closing remarks to our audiences with regards to mental and health wellness.
I just want to say, mental illness is not a curse. And it's not the end of the world. There are many people who have received help and have gone back to being fully functional. And with some people, they may need to stay on the medications, but in most people, if they go early and they have got a high health-seeking behavior, they'll be able to resolve whatever issues are giving them, whatever stress or anxiety or depression, before they have the critical issues like coming to suicide or psychosis, those episodes that we described earlier on. So what's important when it comes to mental health is early health-seeking behavior and being cautious in your own being that I'm not okay, and going to seek out at a health institution.
That's it. Dr. Mzamili, thank you so much for your time, and we definitely do look forward to speaking to you again in the future.
Thank you, Farai. Thank you for having me.
All right. We're joined in studio there by Dr. Tinaya Mzamili, who is a wellness specialist, and of course touching on issues around our wellness. We do implore you once again to keep sending us your questions, comments, and your contributions on our program, as we always do appreciate hearing from you. That's it for now. Pleasant viewing.